Hello, everyone. Welcome to the Thinking Physio podcast, episode number 14. In this podcast, my goal is to bring you some of the industry leaders in rehab, people who have inspired me, people who are doing great jobs, who are going above and beyond just a 9 to 5 and putting a lot of effort in there, and basically people who inspire me in the world of physiotherapy and rehab. And on today's episode, I have the pleasure of having physiotherapy extraordinaire and owner and president of Center Replay, which is basically a rehabilitation and a training facility based out of downtown Montreal in Canada. So without further ado, I'd like to welcome Viviane Cyr to the 14th episode. Welcome.
Oh, hello. Well, thank you. Thanks for having me, Abby.
Awesome. It's my pleasure. Absolutely. So, Viviane, I wanted to tell you a bit about, because this is our first interaction. We've spoken a couple of times, but it's our first interaction speaking face to face. So I'm basically a physiotherapist trained initially in India. And I did my bachelor's there, and I moved to do my master's in the US, and I studied there for a little bit. I got involved in a bit of I didn't get involved in MMA, but I saw people training, and rehabbing fighters in MMA because I was in New York City. And as you know, like there's so many fighters that come out of Long Island. So I had an amazing college professor, used to train with them, and I saw the way they would, train and do their strength and conditioning. And I was looking for like-minded professionals. And when I finally moved to Canada, I came across your profile. So I wanted to chat a bit about just your journey of how you decided to become a physiotherapist and how you got involved with, in combat sports.
Okay, but actually my story, how I got there is a pretty simple stories. Like when I got there, this is where I exploded. But like in the beginning, not exploded, but like when everything bloomed. I mean, so before going to physiotherapy, actually, I got there by accident. I knew I wanted to be in the medical field. I wanted to work with sports, but my first choice, actually, I wanted to be a veterinarian. I did the interview. I wasn't picked. So my second choice was physical therapy, which I never been in physiotherapy. I knew I wanted to be in that field. I wanted to increase my grades so I could go in veterinary. But I really enjoyed physical therapy. I actually ended up doing. I told myself I'm just gonna do the best out of it. And I was training. So how I ended up working with martial artists is I was doing kickboxing, and then my brother-in-law was doing Muay Thai. So I started training Muay Thai pretty seriously, and my coach was actually training high-level MMA athletes. So as I was studying in physiotherapy, I was working with some of the fighters, and then when I graduated, I got hired in a physio clinic, like a random. I just wanted to have experience. I knew I wanted to work for myself, and then I had just a small, tiny microscopic office in the MMA gym, and I was seeing some of the fighters, and then more and more fighters, and like higher and higher level, and they were happy with my work. So I ended up working with some UFC fighters, and they were happy with my work. So anyway, they recommended I should go to do some training in the US, which I can tell you a bit more about it. And my sister at the time, one of my sister was a friend with Elidor Alvarez. He got the WBC champion. He beat
Right.
you know who he is.
Yeah.
She was a friend of him, so she recommended me to him. So he came, we worked together a bit, and then he was really happy. So he introduced me to other boxers, and just like word of mouth. When you show people that you care, they want to help you out too. So it all comes and go, and that's how I made my place in this world.
That's great. So it seems like you followed the classic path that mostly people are trying to take, which is, you start somewhere, you find a little niche, and then you just like keep your head down and you keep working. And if your work is good, people would just recognize you, and they start kind of like flocking towards what you're doing, it seems like.
Yeah, exactly. And martial art is a great sport. I didn't know in the beginning because it's the sport, and like I started with this sport, but now that I'm working with other sport, I realize how mostly MMA people are really open-minded. They already amazing athletes. I think the best athletes are MMA athletes compared to other sports because they're really complete, and they already train in different all the planes of movement. they are compared to their own self, so they need to beat themselves. So if you tell them like, okay, this is a new kind of way that you can maybe be better than the other ones, they're going to be willing to go. And they also like they are used to work with different coaches, so like they used to work with different kind of mentality. They're really open-minded and everything. So I mean, since I work, for example, with hockey player, like the more like lately I've been like working and introduced with the hockey community, which like I think MMA athletes are the best athletes, but like hockey players would be the best sportsmen. I don't know if you feel the difference, like because like in hockey it's like it's such an intense sport, and you have to understand the game and to see everything that goes like so fast. MMA athletes, they will train like 2-3 times a day. They have like different type of training, and they they compete actually like once every 3 or 4 months, compared to like hockey players that they compete, they do like they do a match like 3 times a week, for example. So it's like very, very different. So I got lucky to be in the MMA community, which is very open-minded and very open to like, they just want to get better and to do different things and to be different of the other athletes.
Right. And which you absolutely right. But I wanted to ask you this question about, were you always involved in mixed martial arts even when you were younger, or was this something that you started doing much later in your life?
I started older actually. I always wanted to do it, but like I grew up in a farm village. It wasn't really accessible to me, and my father didn't wanted me to do combat sport. So when I was in university, I was free, so I could do whatever I want. So I started to do like striking in university, actually.
I see. Okay, that's amazing. What is it about, say, Montreal or Quebec, that there's so many fighters that come out of here? Like, of course, GSP was the one who kind of like, I think was the trailblazer. Maybe there might be others before him, which I don't know of. But I also thought about the same thing when I lived in New York, close to Long Island. You'd have like all these Chris Weidmans and L.I. Quinta and all these fighters coming out. And I would always talk to these people. It's like, what is it about, Long Island? So it's the same thing. Is there something special about like Montreal?
I'm sorry. Montreal is really, really Georges St-Pierre. Georges St-Pierre and Firas Zahabi. So like, the thing with MMA, if you want to get better, you got to train with the best. So there is some spots in the world where like all the best athletes, they are attracted to, and they train together. And Montreal was, because since COVID, it changed a lot. Like Montreal was one of the best places in the world to train MMA, mostly because of Georges St-Pierre and Firas Zahabi and the TriStar gym. So like right before COVID, like 50% of my clientele was from outside of Quebec, either Australia, a lot of Americans, people from France, people from China, that would come just for TriStar. But since the pandemic, Canada has been closed for a year and a half, I think, in total. And even after that, like now the gyms are just reopening. It's one of the places in the world where it's the most strict for COVID. So now a lot of the athletes, like the international athletes, have been either stuck outside of Canada and they couldn't come back, or the ones that comes from Montreal or like from Canada, they moved, either they went to either Florida or Las Vegas, for example, to keep training and practicing with other people, because there wasn't that many high level athletes now here. So I don't know if it's going to come back to how it was before, or if it's going to like be different from now on. Right. But it used to be like one of the biggest places in the world because of mostly that gym.
Right, I see. But so the TriStar gym hasn't like moved anywhere, right? They're still there. Like when things start to open up, I'm sure like they'll start training again. And plus now Center Replay is there as well, right? You guys are not going anywhere. So I would think that like as things start to open up a little bit, like people would start coming back.
Yeah, some of them are coming back now. Like some of them from like UK and the US, they're coming back. But like, so I'm crossing my fingers that they're all gonna come back and things are gonna be as they were before. But like it's been quiet since the last 2 years. So some of the habits might have changed since the pandemic.
Right.
We don't know. We'll see what the future tells us about that.
Yeah, absolutely. Yeah, we got our fingers crossed for sure. Like you were describing some time ago, that MMA fighters are so well-rounded that they have to be good in so many things. They have to be strong. They have to be conditioned. And we hear this all the time, right? When back in, I guess, the early 90s, when the MMA fighters were coming out, those, I guess, crop of fighters are so different from the fighters that are coming now. We have heard this so many times. They were good at one thing, right? And now everybody's trying to be good at like everything, which I can totally see your comparison to hockey players, where they, like you said, they play hockey and of course they do their strength and conditioning and stuff like that. But for an MMA fighter, they're doing like jiu-jitsu, striking, strength and conditioning, etc. There's so much going on. I wanted to ask you generally if you could walk us through, and I know every fighter is different, but what is like your role with the fighters? Are you only doing rehab with them, and are they training at these certain other places, or do they do any kind of like strength and conditioning stuff with you, or like anything else performance-based stuff with you also?
Okay, it's really like, that's funny because you say like there used to be like different type of fighters. Like you have like strikers, you have Muay Thai fighters, you have a jiu-jitsu fighter, wrestlers. We still see, you can spot what are their dominance sport just by their posture. You can see like the difference between like a Thai fighter which is gonna be like really really straight and like with their weight on the back. You see the wrestlers like really really wide, being low on the ground, rounded shoulders. You see the BJJ athletes. You can spot the BJJ athletes because they have such weird posture. They're like, how can your spine be bent that way the whole day and then you're not injured? So that's a BJJ athlete. But now, like, yeah, more and more they get more complete. They don't do enough strength and conditioning. Most of the time, they do only once a week some strength and conditioning. Some of them that are like more aware, like older ones that are more aware of injury prevention, they're going to do a little bit more. What I do with them, so most of them, like we start with doing just like by either injury, we work on fixing their injury, or we do maintenance work. So I see them like once a week. They always have something going on. So we fix and we try to fix the movement pattern. And more and more, I'm doing some preventive work. So with most of athletes, you tend to see very, very tight diaphragm and like the rib cage like being like flared up, and the anterior tilt of the pelvis, which like really load their lower back. They have like upper cross syndromes, like rounded like shoulders, which like put tension on the shoulder and on the neck. Right. So we try to fix the tension, doing some myofascial work, some trying to rebalance the chains to make sure that everything turns where it's supposed to turn, realigning the axis of rotation and everything. Right. And as most of them, like the ones that wants to work in prevention and wants to work with their movement, they're really aware of their movement, and they're really aware of like, they're good at feeling their body. So we can go pretty far with them. For example, I worked with one of the fighters. Something that happens often with the fighters, I don't know if like I love showing stuff. Yeah, I love it. Most of them, but not most of them, but like often, like they tend to overuse the latissimus dorsi, which like put a lot of pressure in the shoulder blade, in the shoulder and in the lower back. Right. So like trying to fix, so like if they like punch and they just like do more side bend than rotation, they will always be using the lat rather than using more the oblique muscle. So that's one of the things we do, like trying to make them feel, okay, you feel how. So we need to deconstruct their movement. So make them understand what are they doing, how is it wrong, and make them understand, like reconstruct the new movement. So like going from simple to complex, position, pattern, power. So position, pattern, power, meaning that position, you need to make sure that they can get to the position. So are their lat way too tight, way too hyperactive? So trying to release it, trying to make sure that they can get the range of motion, and then introducing the new movement pattern, practicing it, and then doing the same motion with velocity and power. So position, pattern, power. So we spot one thing, like one of the problem, trying to deconstruct the problem, reconstruct the new movement pattern, integrate it in their fighting stance and fighting posture and everything, and then fixing one thing at a time to make sure they can integrate it properly before their fight camp. So when they are in the end of fight camp, mostly like 4 weeks before a fight, I will not fix anything in their movement pattern. Even if they come here, okay, they have a knee injury, for example, that is obviously related to their movement pattern. Okay, we'll fix like the main thing, but you don't want to change anything major before a fight, because it's going to have an impact on their competition. Like the brain is going to be like, okay, so I used to be doing this way. Like recently I've learned that I'm not supposed to move this way, so I should be moving this way. And then just like the moment that the brain is thinking about the two movement pattern, is going to slow their movement. It's going to be bad for their fight.
Right. Yeah.
Yeah.
No, absolutely.
And I do this, and I also do sometimes in a group setting, because most of them, they all have the same injury. So like if you take like most of the human being in 2022 have the same injuries or the same cause of injuries, firstly, but then you put all the fighters together and like, you know what they overdo, you know what they don't do. So I used to, just before COVID, but I'm gonna bring it back, do small group classes. I called it fighter repair. And we work on like releasing the tension that is built with overtraining of some movement that they have to train. So we release the tension on those movements, and training and then learning some specific movement, but we do it in a group setting and we practice it every week.
That's amazing. Okay. Something really interesting you mentioned here is, I tell this to my patients, I'm more like a gen pop physio. I'm seeing general population. And since the COVID, the pandemic hit us, I often tell people, before COVID, we used to see, if you would broadly classify the amount of patients we were seeing, I would classify them into, number one, people who get injured from maybe, say, suddenly doing too much, right? Somebody took up running, lifting weights or anything like that, and they probably weren't ready for it. And the second, I guess, subgroup was injuries happening from not moving enough. Like that's one thing that I saw. And in 2020, the second subgroup actually overtook the first, because nobody was gyms were closed, nobody was getting active and stuff like that. Everybody's sitting and working from home. So like you said, I would tell my patients, it's almost like since 2020, everybody has literally, it's not exactly the same, but very similar problems, right? Everybody's sitting, everybody's neck hurts, they have pain down the arm and shoulder blade and stuff like that. But I never thought that fighters could have similar like issues as well, though now the way you've explained it, that kind of makes sense, that a lot of those people would come with the same problems. So you could have a group class and kind of train everybody in that same pattern.
Yep. You could be like moving a lot and not moving a lot. Most of people, like, because we're sitting a lot when we grow up, we tend to have like hypertone or like shortened psoas muscle. Same thing with the pec muscle. We're like always here in the front, always using the pec, and just here in that area of like, we're only doing thing in front of us and never doing thing like up here on the side. So we never open the shoulder. Same thing for the leg. Like we never get to not often get to the full range of motion of the extension of the hip. Most people do. So like it's already most of human beings have those problems here, and like the tight diaphragm, because we are stressed in 2022. And then you take this and then you train over that. Athletes, like, what is the funniest thing is that the higher level the athlete is, and the lower level exercise we will give in the beginning, most of the time they have really, really obvious movement discrepancy, is because they get so good at compensating the movement. They are a professional compensator. So they will be able to have like a huge muscle imbalance and be able to not really get hurt, or like being very functional with this. But you take those athletes and then you tone them down, make sure they fix those little discrepancy, and then you put some complexity over that.
Yeah, interesting approach. And I really like that. Could you go over the 3 steps that you were telling me before? Because I had a point for that, but I forgot the three.
Position, pattern, power.
Okay, yes, perfect. So with position, pattern, power, like There's one thing that I noticed, which I feel like your principles of physiotherapy align with mine, is, and a lot of other forward-thinking physios now, you know how like a couple of years ago, we would always think about static stretching and flexibility and stuff like that. And we would think, hey, you know what, if your arm cannot get into full, say, overhead flexion, then whatever, stretch it until it does. But now it seems like that concept is changing. It's not just about being passively able, or or struggling to get your arm up here, but it's the ability to control that motion as well, right? So it's the ability to own that mobility. So it sounds like a lot of those three steps include, first you help them regain the motion, and then they own it, and then they develop power out of that position.
Yeah, exactly.
That's
Exactly. It looks like a bit of a FRC, functional range conditioning. You might, do you use this approach?
I don't use that. I know it's based out of Toronto with Dr. Enderos Piena, right? I have seen a lot of it, but he definitely does that too. But I feel like a lot of people have now realized that it's not really just about static stretching. It's about the ability to hold it. Yeah, but I know exactly what you're talking about.
Yeah. I mean, like it happens so much, so often that young or like new people that are just starting fighting, they come and they're like, oh, I need to stretch my legs because I cannot kick high. But like the flexibility has nothing or almost nothing to do with kicking high or not. I always give the example of David Moon, which is the stiffest athlete I have ever seen, but he knocks everybody with high knees, high kicks. But that's because how you could like the ability of doing high kicks will be more, it's not only related to the flexibility of like the inside of the leg, for example. It's often more related to the strength of the outside of the leg, like the ability of the opposite muscle to make sure you get to the end of the range of motion and you be able to hold it there and to use the power over there.
That makes a lot of sense. Yeah. So it's not just flexibility, but the strength on the opposite group of muscles to hold it and keep the leg and generate power through it.
Yeah,
that's
because sometimes they get muscle strain, like adductor strain, and then they just stretch the adductor, stretch the adductor, stretch the adductor, and then they get hurt again, get like scar tissue in the adductors. I'm like, leave your adductors alone. Strengthen your glute at the end of the like get in a split and strengthen the glute at the end of the range of motion. It's gonna be way more efficient, and then you solve like so many problems with that.
Right. Yeah. I wanted to ask you, Viviane, do you see, so it seems like a lot of people come to you for almost like preventative or maintenance work. What about like after injuries, like people after a fight or after like any major injuries during training? Are you rehabbing a lot of people with those as well?
Yeah, that too. A lot of knee injuries. Okay. That's my favorite thing to work on, because that's one of the reasons why I did this space. I created this space is because I don't think you can rehab a knee problem without having the space to make people run, make people jump, like cut and everything. So that's one of the reasons I needed a big turf to make people move. But like rehabbing, and we're building a very strict progression and like rehab plans. With like the progression, and we're passing people because I believe there's no treatment philosophy that is 100% right for 100% of people. So like depending of the type of person you are, the injury, the exact injury that you have, the type of involvement that you're going to have, the mindset you have and everything, different tools are going to be good for you. And all the physiotherapists, each physiotherapist don't have all the tools. So we don't have all the answers for everybody. So that's why we created a team, and we're working all together with the team around the athletes or the general people for their rehab. And then so we introduce a lot, like for rehab, like real rehab and return to play, you really need to introduce like physiotherapists, yes, but like kinesiologist is really, really important, and the physical preparator is really important, and talking with the coaches and make sure that the coaches are like work together with you to either reduce the workload while you fix the injuries, or like fixing the movement, or fixing the exercise that is hurting the athletes all the time. So it's a lot of communication, a lot of collaboration. It's a whole plan rather than just like working just piece by piece with the athlete.
Yeah, absolutely. I agree. Do you feel like a lot of the athletes, the whole process that you explained me, clearly athletes would have to do all of that to get back to the peak performances. But do you utilize those principles even for your general population where people might not be as active? They're like, oh, if I can just like walk a little bit or something, I'm okay. I mean, like, of course, I don't think people say that they want to get better, but do you put them through the whole thing as well? Like you're putting through the rehab, but then having them cut and like do high performance, not high performance, but for them
high performance, but it depends. People come to most of the people come to me, general people, they are still active and they still want to do things, even if like it's simple things like I want to walk up the stairs, or okay, cool, but you need to have the strength to walk up the stairs. You need to get through the training phase. If that's your problem, if you want to jump, you need to learn how to jump. Depends where you want to go. It always depends from where you start and where you want to go, but there's still a plan. It's just that you don't have to go as far like as those athletes, right, for sure. But most of the time they don't have the same things to work anyway. So at least we have like the baby step that are going to be missing, but then they do huge step most of the time and it goes fast. Where regular people, regular general people, they will have this movement discrepancy too. You will have less things to work, but most of the time you're going to take longer to work those things. So like one thing at a time, step by step, making sure that they have victories along the way and that it makes sense for them. But yeah, I'm an active, I go with activity, I go with exercises, movement. So I make them feel the exercise and everything. But I'm not going to push them through a performance if they don't want to do it.
Right.
That was a question?
Yes, yeah. Because a lot of times, like your facility is different. Like clearly, when I look at your space right now, exactly what you said, you can do all these other things. But as you may know, like a lot of these other physio places, I mean, and they're not meant for those sometimes. But even then, if you have like a small space and you only have room for 4 beds, and all you're doing is having your patients do like active knee extensions and straight leg raises, like that's not enough. Like even for the general population, I feel that's not enough, right? So you need that space to move around, at least do like lunges, squats, something like that, right? Which because I've worked in facilities where like we didn't even have a gym space, and I was like, that like it doesn't sound like an exact physio place. At least you need a little place to move around and stretch and stuff like that, I think.
I agree with you. I think physio, our profession, is moving so much in the last years, and it's going in the right direction. More and more physio center are combining with strength and conditioning center. They have more and more gym, or they recommend exercises to their clients. But I agree with you. You cannot fix an injury if you don't want to move. The body is meant to move. You have to make it move. You're supposed to be at least strong enough to do your everyday activities. So you have to get through it. I agree with you. We need to make them move. Right. Just like tense and like passive exercise, passive treatment will not get you anywhere, I think. Yeah. My opinion.
Oh, absolutely. I'm 100%. And this is one of the things when I'm looking at people, I'm looking at exactly what you said. Hopefully they're not overutilizing modalities. Like when I was a younger physio, I had like stronger opinions about modalities. Now, like with experience, I'm like, you know what? I don't have to bash them every time. I know where I stand with them, which is if this is how much the rehab process is, like that's the use of modalities and that's it. Before I would even bash that little part, but then sometimes I feel, okay, maybe some people may need it, but that's about it. But if that rehab, if that part of the modality now starts to take the entire rehab, now that I don't necessarily agree with a lot. But I wanted to, touch upon this is a great segue to ask you about, so you mentioned movement and there's a great emphasis on movement in your practice. When I was seeing some of your social media videos, I see people doing a lot of now I'm not sure exactly what it is, but you can tell me. It seemed like the animal flow kind of, like movement with sticks and stuff like that. I've seen some people do it. Could you briefly talk about what's going on over there? Like, how do you incorporate? Like, what principles are you incorporating when you do those movements?
It's mixing a lot of principles. So I did my MoveNat course, the level 1 certification. Then I did it's in inspired by animal flow. So I followed a lot of animal flow. Then the On It course, I did the durability course. They use a lot of that. So they combine FRC, RPG, and animal flow within their practice. Then some of it's fighting monkey, the one with the stick that you need to avoid, and then with the ball to make so it make you so if you make them think about like a proper position or proper movement pattern, and you try to make them play, because the human learns so much when you're playing. You record what is happening, and then you just go with you get in the flow state, and that's the magical state actually, to make them learn and make them integrate what you tried to teach them. And also like a lot of it come from ICUS. It's a course from here in Montreal. So it's all combined. So it's all combined with proper posture and actually movement efficiency. So how to use less energy to do a maximum result.
Right. Yeah, no.
Have you heard? You know MoveNat?
I don't know MoveNat. No, I've heard some of the names you said. I've heard of Fighting Monkey, but I'm not sure of MoveNat.
Okay. So it's So like with working with animal flow and like the crawling is such an amazing way of strengthening the body, and like it's a kind of a game. So people it's okay, you get on all four, and then you need to balance, and then to reproduce the movement of an animal ish. It's trying to balance your body, and then you use different muscle that you wouldn't be using when you're standing up. It's making them play. It's making them move in every angle of your body that you haven't been moving usually. Make you discover different muscle. Empowers the person with those kind of exercise. It's really, really fun to do.
Yeah, and I think like for anybody who might see some of those movements and they've never done it, but they're super into strength training, like just squats, deadlifts, and bench press and stuff like that, and they may look at it and say, oh, that's easy. Like, I'm sure that's not easy when you first start to do it, right? Like it's a great thing to do, but it's so hard to get into those motions. And suddenly you're like, I never felt these muscles that I could work them with those movements, right? Do you have that experience sometimes where somebody may come and say,
all the time. All the time, and they get frustrated because they look so easy, but it's so complicated to do. Mostly if you want them to do it properly, like having like the proper coordination and like loading properly, like and working opposite head, opposite feet is really it's complicated. Right. It's challenging. It's humbling for most of people, even athletes. Most of the time, when it's the first time they do it, they're really bad at it.
Right, exactly. I could definitely imagine that, because I've tried some of those. I remember like a couple of years ago, I took NKT workshop and some rock tape. I was just doing some taping, and the guys who would teach that were also teaching a lot of animal flow classes. So they put up a little demo where they were showing us how, and you're like, oh, like they tried to have us move like that, and that especially after you're sitting in a workshop for like, so many hours, and suddenly they're like, okay, you know what, get on the floor, everyone. And suddenly everybody's trying to move, and everybody's eyes kind of lit up. It's like, if you're not training like that, you should probably think about train like that a little bit.
Yeah. I think everybody should introduce those kind of things in their workouts, right? Because we're always like either standing up, like squatting and everything, but we never load horizontal and then try to do things horizontal. I think it's relevant for everybody to do that, and it's fun, and you get better pretty quick actually to those kind of things. And then like when you get better at those things, then you get better at other things, because it works your cross system a lot. So it works the stability of the spine and the stability of the spine. So then when you're standing up, you can just like being more like agile in your feet, and then feeling the weight on your feet and everything. Right. Pretty cool.
Viviane, I wanted to move on and talk a little bit about your facility, which I am just in awe of. Like every time, so I've been following your work since before you opened it, and then I saw your videos. I still remember when you first got your keys. I remember that one when you were like opening your facility, and then when I just saw it, I was like, oh, that just looks so beautiful. It's the kind of place where honestly I would like to go to work every day. I was like, this looks so cool, just to go there and work looks amazing. So what was your journey of opening Center Replay? If you could just briefly describe if you had some challenges or like the big moments and stuff like that, and how you decided to move away from working from somebody, because I know you mentioned that initially and you started your own thing.
Mm-hmm. So I worked for a company like a year, and then I had like my private practice on the side. And then just after a year, I was by myself. I put money aside for 5 years. And then I decided to open Centre Replay. In the beginning, I was with 2 other people to open the center. We had all the trouble you can have, all the obstacle you can have. It was so hard. Actually, in the beginning, it was a project, like a medium-sized project. And then by the time it got bigger and bigger and bigger, and then it ended up being, it's a pretty big space. We have like a pretty good corner over there. We've been able to, it's been hard to have this local here because we're not a big chain. Like we did everything by ourselves.
Mhm.
And then like in the beginning, the opening, everything was so hard with the architecture, getting all the loans and everything, the lease.
Right.
So sometimes I'm looking for my word, and the lease and everything. And then when we got it, like the construction and everything, bam, the center opened. We were not, everything wasn't ready. We still were working so hard. And then 6 months post opening, the pandemic started. So we had such like, it was pretty hard because the government, for the help, like the subvention, they compared with the money you had the year before, which we were not open. So we didn't have much help from the government during the pandemic. So we started the rehab side, but we were supposed to do like the training side in the same time. But because of the pandemic, now we're just starting to really develop the training and the performance side. We really focused on the rehab for the whole pandemic, but it gave us a moment to just like, I would say like lay back and like really focus on doing like good rehab protocol, focusing on the rehab, doing the thing properly. The first wave that we had to be totally shut, but we still had, we had a bit of salary for the therapist. So I hired my employees just to search in the literature and try to find the new innovation in the rehab of like shoulder, spine and knee injury, getting like really precise protocol. We did a lot of work that was amazing. And then now the team is growing, and we're adding I said that we just add a hypnotherapist, we add a psychotherapist, now we add another physical biokinesiologist. We're looking for occupational therapists. We're still growing and selling ourselves, but we had all the hard things you can imagine having when you're starting a business. We had them.
Wow. Yeah. I can only imagine, because opening a business right during the time of pandemic, for people who've not had a business like that, we can only, you've given us a bit of an insight on what some of the potential problems can be. But through the pandemic too, we hear these things a lot, right? Like you open your own business, you've been dreaming about this, and suddenly this happens. But it's great to know the team's kind of growing. Suddenly now things are opening up in Canada, which is looking positive. So I wanted to ask you about Center Replay. What are some of the things? I've seen a bunch of things in there. In your website, which is really cool. I see you guys have physiotherapists, like you said, massage therapists, osteopaths. I have never seen a office which has a spa and an ice bath center too. So could you tell us everything else? What all does the facility incorporate in terms of training and rehabilitation?
But in terms of professional, we have physiotherapists, massage therapists, osteopath, athletic therapist, kinesiologist, psychotherapist. hypnotherapist.
Right.
I'm like,
You
what,
have them
what's
all.
what else do I have? Nutritionist.
Okay.
But then in the spot we have like a fully functional gym. We have a spa and a cold plunge, and we have an immersive yoga room. So that's one of the things that with the pandemic we used to sub-rent to a yoga studio.
Right.
But like in the beginning of the pandemic, so the yoga studio couldn't make it, but we still have the immersive room. So we're gonna get back to it, like doing some breath work, some Wim Hof.
Oh,
You
yes.
know what?
Yeah.
Yeah. So we used to do it. We're gonna bring it back when we're gonna be able to do a group class of people breathing heavily beside each other.
Right.
That's one of the first things I want to bring back.
Right.
But using the immersive room, is really nice. I'm gonna send you videos of that, but you can put the whole room in a different color. So being in a color is going to affect the mental state that you're in. And then when you put like music and so you stimulate your senses so that you can focus on your activity. Your brain can kind of stop and like be in the moment, which is really interesting. So you can do meditation, really focus on your practice, your movement practice, like your yoga session, for example. This is some of the things we have. We also have the knee KG, which is, do you know about the knee KG?
No, I don't.
Amazing tool. I believe in their technology. It's a company from Montreal called Emovi, and they do a knee KG, which is a knee arthrokinematic evaluation tool. So it's a basically it's kind of a brace that has some pressure points on the bone on the knee, and a infrared camera capped, like see like the pressure point, and it's gonna see like the movement of the tibia and the femur while you walk, while you jump, while you squat. We did it like while skating. That was really interesting. We have an artificial ice actually, and we put it in, trying to see like the knee movements on the ice. It's amazing. You can see the absorption, deflection, and extension of the knee. You can see the hyperextension. You can see the adduction, abduction, the thrust when you walk, and you can see the rotation of the tibia, which we cannot see with just with the eye when you walk. And we can also see the drawer of the tibia when you walk. So you can see how does your ACL actually work when you walk. So like I had one of my fighters, for example, he had an ACL sprain that we can feel, we can test. But when we tested him on an EKG, we see that when he walks, his knee is still solid. So it's like, okay, fine. When we tested, you had a sprain, but your biomechanic is not affected. So like technically your ACL is fine and it will not get injured more. And on the opposite, when we see some people, they seem to have like stable knee, or actually it totally changed the way I'm working with the knees, because you probably seen that most of people that had a knee sprain, not most, but a lot of them, their tibia has a tendency to be locked in external rotation. I don't know if you saw that. And then with the old mentality of manual therapy, it's like, oh, okay, you're fixed in external rotation. Let's do mobilization in internal rotation. It is stiff. But then when you see those people on the knee KG, some of them, they're fixed, they're locked in external rotation because weight bearing during the loading phase, their tibia go in internal rotation, but not controlled. So like your body is like fix the tibia in external rotation to make sure that you don't overly go in internal rotation when you're weight bearing, which blew my mind. I was like, oh my God, I'm never gonna do that again, like before testing really weight bearing. So anyway, that's one of the tools that we have and we're using a lot.
When you say you see this, do you mean you see that on a screen? Like when you attach the brace on, is that what you're seeing on the screen?
Yeah, you see the bone moving. I'm gonna send you a video of that too. It's really, really nice. You see the bone moving, and also like there's a like analysis, and it precisely say like how does your bone moves.
That's amazing. Wow. That's I saw that on and I wasn't even sure. Now that you told me, I was like, oh, that looks like, I don't know, it's that gait analysis or what that, but that's probably what it is. I didn't know, but yeah, when I looked at it, it was focused on the knee and it looked super cool. With everything that, when you were talking about the yoga and that sounded like almost like a sensory deprivation kind of concept, right? Where like there's not a lot of stimulus, and you know, like you can focus on, I guess, like breathing and meditation and stuff like that. Was that what you
Yeah,
were like, the idea behind it?
yeah, it is.
Excellent, excellent. Wow, that's amazing. Vivian, I know I've taken a lot of your time like on a weekend, but I did have a few more things I wanted to talk to you about. Like one of the things that I wanted to ask you was, I know I think some time ago you traveled to the Onnit Academy and you did some like training or certification there, which looked super cool. Honestly, as a physiotherapist, like I have all these different workshops and courses that I'd like to do, but Onnit Academy was never on my mind. I never thought about it. I have heard about it from the likes of course, like Tim Kennedy, Joe Rogan, and all these guys. But it makes perfect sense why you would do it, because you're not the classic physio who's just like treating somebody on the, like you're doing all these other things. So it kind of makes sense that you went there. But could you tell us a little bit about the experience you had in Onnit Academy for most of us who don't know what goes on over there?
Yeah, for sure. It's a really great course, mostly when you do group courses, the durability class. But, or if you want to do preventive work on an athlete, not an athlete, on any type of people. It mixes yoga, it mixes animal flow, but with intention. So and it mixes FRC. So it's kind of like FRC. So you would like get in a kind of a yoga position, and then you're gonna contract your limb in some specific way to activate the muscle, and then move the fascias, and then get stronger in those range of motion, and then get used to do those motion, and also doing those activation the proper way and those contraction the proper way. It's a great course to strengthen. I would say, like for me, it's like 0-1. So it's mostly so the durability course would be like low intensity mobility exercise that you should do often. It's kind of like yoga, but like kind of higher and more specific to more specific, I would say, like more modern type of yoga ish.
Right. And how long is the course generally?
It's a 2 days course.
It's like a
And
weekend.
I strongly recommend to go to Onnit. People are amazing over there. Austin, they say keep Austin weird. So like everybody's like kind of funky, like really nice. They talk to everybody, like really welcoming. I strongly recommend to go over there and get the course. But one of the course I would like, you were asking me before we talked, which tool that I use the most. I would say the course that made the biggest difference, or some like the first course that made the biggest difference in my work was when I went to Exos.
Okay.
Have you heard of Exos facility?
I have, but I don't recall what course they offer though.
Okay, they have like 5 big facility in the US. They work with 400 physio clinic in the US. They do the different course like with performance, and they do one course called Rehab Mentorship, which is a 4-day course, and it changed the way I practice. This is the first course that I did like in 2015. When I went over there, I told myself, wow, this is what I want to do. This is the kind of facility I want to do. The way they see, it's like do the basic right, and like you need to communicate the proper way in different in between the intervenant, in between the professional, so that the athlete can go back to the sport. And also it's a way to classify the athlete and to give the minimal information to the other clinician, so that they can take the client and make him progress in their rehab. So that's the Exos, the Rehab Mentorship. And then I did the Performance Mentorship with like they push a little further, they push way further actually, the performance level. So that's one of the courses that I would recommend doing. And then another one is PRI, Postural Restoration Institute. They're based in the US. You know about them?
Yes.
Have you did some of their course?
I've the classic one, which I think like almost a lot of people have done, which is like took their online module, but not through PRI, but it's the one where you do the balloon with the diaphragmatic breathing and the pillow with the 90-90 breathing position. So I didn't do it through there, but I did it through another. I don't know if you've heard of MedBridge.
MedBridge, no.
So basically, they integrate a bunch of that, but the credit goes to PRI for starting. Like I remember a couple of years ago when I first saw PRI, the classic position was like the 90-90 with the balloon breathing. And so I followed some of their work for sure.
Yeah, but like the course, the myokinetic, the first one I did is the myokinetic restoration, which is the pelvic and the coxofemoral joint.
Right.
And just, it's the first time that I heard anybody talking about the body is in a three-dimension way. We, in physiotherapy, we see like often in the course, we see like the anatomical position, and then, okay, the muscles are made this way, and then you talk joint by joint about like how they move.
Right.
But like PRI, they say like, okay, if you're weight bearing and then you do like your right pelvis rotation, then you're gonna have like the two coxofemoral are gonna do like opposite rotation. And then like if your pelvis is in anterior tilt, then you're gonna have like your coxofemoral joint is gonna be in a specific position. So it's really interesting to just like take a step back and see the body as a whole and as a three-dimension. It's amazing. This is the main course that I made me think about integrating the different like muscle chains and how the muscle chains are going to act to a different the
Right.
opposite side of the body, and how okay, so you have a muscle chain that is pulling the pelvis in one direction, then the pelvis is torqued in one direction, so it's pulling on the opposite chain on the other side.
Right.
So why is this all connected together?
Right. Yeah. No, absolutely. My introduction to something like that, where, you know, like traditionally we would learn, like you said, joint by joint, everything moves in a certain way. You know, if it's a shoulder problem, it's only a shoulder problem. The first time I got integrated to a concept which included all of this was actually a combination of some of the stuff that I saw at PRI. It changed the way I would see back pain patients. And of course, since then I've made certain changes, but especially back pain. But then there was the slow introduction of like FMS and SFMA and stuff like that. Which of course there's a lot of controversy on those two, and you know, like but that was the first time when you were like, so you probably don't want to just think of a shoulder problem as just a shoulder problem, and you know, take the body as a whole, and you know, try to figure out why could a certain area in the body affect some distant site. So yeah, no, I agree. I kind of like that too. Are there any specific like courses apart from that which are more like physio oriented with change? Or like, for example, like did you ever go through like the classic McKinsey or like the Mulligan or Maitland or anything like that?
I did the first level of the classic McKinsey. I love that.
Right.
And I think you need to combine it with other kind of therapy. Or right now I'm just starting the joining link course, which is like so interesting. So I'm just in the, like, you know, the recap of the inflammatory and the healing process. Right. And they make a chart of everything that have to go right to make sure that you heal properly, and actually make you realize how you're lucky when your fibers heal properly. Most of the time, like, there's so many things that can go wrong, and that can make some scar tissue that you will have to adapt to this injury. It's humbling to see that, and like to realize that, okay, it's fine if you don't heal properly. The body is made, it's okay, it's gonna compensate for that, and that you don't you shouldn't be you have to accept that healing is a hard process, and most of the time it's not 100% made properly.
Yeah, it's not pretty, but the body is resilient, right? Yeah, I tell people too, like a lot of times we feel like our body is so fragile, but honestly, it is robust, and you can train it to be like that. And yeah, exactly, like rehab or just, I guess, the rehabilitation part, like you said, is not pretty, but at the same time, like, it is a robust process, you know. So if you put some effort into it, like, you know, it kind of helps clear this whole fear avoidance, you know, where we feel like, oh, you know, I don't know if I've damaged my knee if I just do stairs or stuff like that. So no, I agree. Yeah, absolutely.
Like, okay, maybe there's something gonna be like, maybe it's not gonna heal 100%. There's still gonna be something, but like the brain is amazing. It's made to make you survive in the wild, being chased by your saber-tooth tiger. So if your knee got injured and that it's not healed 100%, it's still gonna be able to make sure that you don't feel the pain anymore, that you're still functional, that you still can do your things. And when I say that it's not healed 100%, it's that it's healed. It's not like the fibers are not going to be smooth and so elastic as they were before. Sometimes there's going to be scar tissue. Sometimes like, there's going to be like, adherences that are going to stay, or you're not going to have like 100% of the strength back in your muscle, but still, some other muscle are going to take the load. Something else is going to happen. The body is amazing to adapt, and it will adapt. Yeah. And we're talking a lot about like physical, like courses, physical, I mean like FRC, we're talking about the rehabilitation course and everything, which is all like, we talk about your body and the way your body moves and everything, or like healing the body. But like, we in physiotherapy, what I feel is that's okay. We in our courses, we learn that there's different kind of pain, and there's different origin and component of pain. But we only know how to address the physical, like the nociceptive one. Yeah. And then we know how to recognize where it's not the nociceptive pain anymore, but we don't know what to do with it. Yeah. And who to send them, those people to, and what to do with this. So I think, so that's why I surround myself with other kind of therapists who are going to have like those type of answer. But that's something I will study more and more in the upcoming years, how and like what to do in the beginning of the injury, to make sure that you get rid of the nociceptive pain, the injury itself, but also like all the anxiety, all the fear around it, all the compensation, to make sure that you really get through the pain without like it being chronic.
Right. Yeah. That would be yeah. I wanted to share this one conversation I had with another physio friend of mine, when I actually told them that I would have a chance to talk to you. So I shared your profile, and I was like, oh, so this physio looks really cool. And, you know, and when they saw it, it's funny that they highlighted one of your posts, in which you were doing a lot of cupping, right? And I don't know if you notice, like, our world of physiotherapy, just the world of rehab, and this is only physiotherapists, there's a lot of infighting between us, right? Where people come out and say, well, what is evidence-based practice? There's this one side which is firmly rooted and they won't budge, and they're like, okay, this is evidence-based. And then they'll bash on anything like cupping, kinesiotaping, stuff like that. And then there's the other side, which is rooted in their own thing. So anyways, my friend, he was like, oh, but you know, she's doing cupping, which is not rooted in evidence. And everything you told me right now, from the tendon, which is pretty much like the tendon remodeling that we know now from Jill Cook on the tendons. When they heal, the fibers are not aligned exactly straight. They're all over the place. Everything else you were describing, it almost sounded like the biopsychosocial model. And in the last an hour, we've been talking about movement and everything else. This is exactly what I was highlighting to my friend, is it's really, when you deal with performance athletes, right? Like, a lot of athletes have their maybe certain things that they like to do right before a game or something, which is not rooted in science, right? Like, some people like to have a certain meal, some people like to get a cupping to feel good. So I was telling him, it's like, when you reach a certain amount of performance, that's where you're not showing people like a research paper on their face saying, hey, listen, cupping does not do anything, so why are you doing it? Because, hey, if that helps them with the way they perform, like you were saying, you don't change people in the last week, even though it might be the right thing overall, but it kind of almost plays with their mojo when they're fighting, right? You don't do those things. So that's what I was trying to tell my friend too, is like, listen, number one, like, it seems like everything that you're doing is part of these other cupping and other modalities are a smaller part of like the other stuff that you're doing. And sometimes I find our physios are so stuck in this whole, they dig a trench and they're like, okay, this is evidence-based and I'll not do anything else. And I tell them, listen, you got to understand, if you're working with high performance athletes, which by the way, a lot of us physios are not, it's some of the physios like you who are doing it, you understand the way they think a little different from us, right? Even though we know that kinesiotaping, for example, does not support, and kinesiotaping is a big one for me, even if the literature and the research doesn't support it very well, but if somebody puts it on and say, if it's their, like, if they're going to play a match, it's a hockey game or anything like that, and if that gives them a 0.1% edge, I mean, I think I'll take that research paper and I'm going to throw it out.
Yeah, I totally agree with you. The thing with science, like in physiotherapy, we are we everything we do is science based, or like that's our motto, to use science-based stuff, which is a good thing. It gives us an edge compared to like other therapists, and it makes us like closer to like the medical, and makes us more credible, reliable.
Yeah.
But also we need to be more open-minded, and like to try to pull the research. Like if more and more physio like you and I use those type of modality, like what about like there maybe we'll have like more and more researches on those modality, and that will prove if it works or not. If we talk about cupping, it's been using since 2000 years by the Chinese medicine. So like there is there should be this, we should find there I'm sure we can find some research on it. You never find any research on it?
I mean, to be honest, like depending on who's presenting the research, there's good and bad both, right? Like this side can say it's good, this side can say it's bad. But it's almost like if you saw some of the athletes and their pre-game like whatever rituals, right? That's the word, their pre-game rituals. So I asked a lot of these people, do you think these pre-game rituals are backed by science? Right? If that's the whole biopsychosocial model is based on, is we are not talking just about is n is equal to 1 in your research paper. We are talking about how there's so many variables, and some people need a certain thing to feel better. Like for example, I get asked by a lot of physios about kinesiotaping. They're like, a lot of physios now like to bash on kinesiotaping, saying it doesn't do anything. But I tell them, if I was only doing kinesiotaping to my patients, I would understand your point, right? But if I do this for one patient where I put a kinesiotape on and now this patient can go home and do their home exercises, then I don't see why there should be a problem with that, right? Because at the end of it, our principles are still in the right place, that we want them to move, we want them to do active-based physiotherapy. And if we use tools like instrument-assisted or cupping and or kinesiotape, but if they're a means to an end for our patients to get to what we really want, which is what we've been talking for the last 1 hour about, which is movement, active exercise stuff, I see no harm in it. So like you said, with the research, we can have like both sides come up with their own research. I just like to feel that I'm not exactly, I tell people I'm not evidence based, as in that I'm stuck in evidence. I'm more evidence guided. So if something guides me towards the evidence, my general principles are that I would move in that direction. But if I use certain techniques which right now may not have had the best paper to support it, but my patients anecdotally do support that, I don't brush that off. I know some people totally brush it off. Oh, that's just anecdotal, right? I was like, there's some value to it, I think.
Yeah, I love how you say not evidence-based, evidence-guided. I love that. I love the way you say it. I'm gonna steal that from you.
Actually, it's not mine too. I heard it from somewhere else. So feel free to. Excellent. Perfect. So I would say we'll probably wrap it up, because I took a lot of your time on this weekend, but it was a great interaction talking with you. Viviane, where can people find you and Central Replay online?
At www.centrereplay.com, or we're right corner Saint-Denis and Rosemont, Metro Rosemont, right over here in the middle of Montreal. Or my Instagram, Viv Cyr Physio, VIVCYR Physio, or the Centre Replay's Instagram, Centre Replay, like all stuck together. Right. You can find us over there. You can write to us. We're really open to chat and learn about to have different mindset, and to be challenged and to learn from other people. That's what we want to do. Thank you very much. I thank you very much for inviting me. That's very very exciting.
Yeah, for me as well. I've been looking forward to this conversation for a while. I'm looking forward to future conversations with you as well. Hopefully, when I'm traveling, I'm not too far from Montreal. I'm in Ottawa. I often come there, so hopefully, if I'm there next time, and if you're available, I'd love to come and see your facility. And
come visit, and you'll be able to see, and we'll be able to chat and to compare our type of work.
Exactly. Yeah, that'll be perfect. I'll add all the notes with your links to your profile and your office profile in in the show notes there. Once again, it was an absolute pleasure and a delight for me to have a chance to interact with you and everything that you're doing. Thanks for putting all the work out there and helping these people and inspiring other physios along the journey. Thanks a lot, Viviane. It was great.
Thank you very much. Thank you.
Very welcome. Take care.
Bye-bye.